We have Dr. Neil Martin here, Director of the Neuroscience Institute for Geisinger Health System.
So, what you've seen so far are exciting case reports of the next generation of neuroimaging. No question in my mind about it. There was just an article in the MIT Technology Review that came out a couple days ago that one of the headlines is Microsoft is all in on virtual reality. I encourage you to take a look at that. We just heard from the futurist in our previous talk how things are changing very, very rapidly. So these case reports you just heard, I think, are going to replace our traditional paper and color image case reports that we've been used to seeing throughout our career. We're going to now explore in virtual reality case reports that integrate the fusion of multiple types of imaging and intraoperative video, as you saw in those last two cases demonstrated very nicely. What we're approaching now is an entirely new generation of neuroimaging, of surgical simulation and rehearsal, of flying the mission ahead of time before you get in there and you start doing the surgery itself. What is this offering that we don't get in traditional neuroimaging? These reconstructions you're seeing are constructed from the same kind of images we use for intraoperative image guidance. These are thin-cut CT scans, CT angiograms, MRI scans of various sequences, and DTI, and they're fused together in one volumetric three-dimensional image that you can cut and slice through and see the internal structure of everything. You can segment the individual types of anatomy, so the scalp, the skull, the brain, the veins, the arteries, the fiber tracts, the tumor, all can be separated. Each can be manipulated. They can be rendered semi-transparent or stripped away entirely, one by one, until you see that critical anatomy that's necessary for you to plan the perfect operation. You know, what does it take to win the Super Bowl? Certainly it takes talent and skills acquired through lots of practice and lots of experience. But the winning team is the one that has the best game plan. And the game plan recognizes the opponent. For us, that's a cavernous angioma or an aneurysm or an AVM or a skull-based tumor, and recognizes the setting of the game so that you can set a game plan. When a battle is planned, you have to recognize the characteristics of the enemy, again, the lesion, and the terrain involved. The terrain involved is all the surrounding normal anatomy that we have to protect. So we have two jobs. We have to approach the pathology and eradicate it or correct it, and we have to design a trajectory that's going to avoid all of the critical structures that have to be protected, which is the essential thing, obviously, for the patient's great outcome. So this technique doesn't just allow you to look at it, it allows you to interact with it, to see the different layers, to fuse multiple images, and it gets you inside it. And so we're all going to get inside a cranium, and I'll let you know about the case here. This is a middle-aged patient who came in with a spontaneous hemorrhage. We weren't sure whether it was related to a middle cerebral artery aneurysm, and we weren't entirely sure of its exact relationship to the critical fiber tracts, and we wanted to know those before we went in and used a minimally invasive approach to take out the hematoma. So in just a second, you're going to take your glasses. You'll see the video on how to assemble your personal VR headset. You're going to take the glasses, you're going to clip them to the middle of your screen, just as you see in the video here. You have to launch the ST360 VR app now. I'm going to use a Vive headset that allows me to look around inside the cranium just as you will do on your phone, and you'll be able to interact with it independently of the way I'm looking at it, although we're all going to be on the same fly-through trajectory here coming up in just a second. So get your phones out. The countdown is starting now. And you should be seeing 1, And here comes the video. We're going inside the cranium to see this intracerebral hemorrhage, which has been constructed from the fusion of a CT scan, a CT angiogram, an MRI scan. There's the hemorrhage. The blue is the surrounding edema. We see the vessels from the CTA. The yellow gold fibers are the corticospinal tract displaced by the hemorrhage. Look around, look up, look down, evaluate the anatomy, and we have to choose a trajectory. Where are we going to enter the hematoma? We can also see as we look at the CT angiogram that there is no MCA aneurysm there in the Sylvian fissure next to the hematoma, so this is a hypertensive hemorrhage, and we will see all the fiber tracts here. That's the critical anatomy that we've got to avoid as we select an entry trajectory, probably something along the posterior or posterior lateral approach. And we also know we cannot suction in the area of the yellow fibers, the yellow corticospinal tract fibers, for fear of causing a problem. Now we've also digitized a brain port. And so the brain port has been lined up on the appropriate trajectory. It's going to take us right to the hematoma, and we're going to use that tubular retractor to assist in the resection of the hematoma. Alternatively, we could use an endoscopic technique. So here we are seeing those cortical spinal tracts again as they travel along the hematoma. We don't want to suction there. We don't want to disturb them as we remove the hemorrhage. So that's the kind of exercise that we're all going to take, and I think we've certainly approached a record for the most simultaneous virtual reality experiences ever conducted anywhere by the size of the crowd, which is probably over the previous record of about 1,100. Certainly we've set a record in getting more than 6 neurosurgeons to be instructed to do the same thing and actually do it at the same time. So thank you all for your attention, and gentlemen, if you have any questions, I'd be happy to address those.
I think we're about at time, but I'm very pleased to announce, although it has to be certified, we have broken the record with over 2,057 people. So
yes.
Thank you, everyone. Most neurosurgeons